Hi, Chelsey.
Hi,
Thank you so much for being here. I would love for you first to just introduce yourself, how you like to most be introduced.
thanks for having me. I'm Chelsey Canavan, and my title is the manager for the Center for Advancing Rural Health Equity at Dartmouth Health.
Beautiful. And so we've worked together on a few different projects over the past, let's see, would it be 3 years?
Yeah,
Yeah. And so I would just love to hear like the first time that we connected, what was going on at CARE that made you want to reach out for support with storytelling? What were you hoping to accomplish and do with our work together?
yeah. So our focus is rural health equity. Um, and, I think um, part of what we hope to do is kind of increase awareness and excitement about rural health equity issues. And, I think there tends to be kind of maybe a lack of awareness, not necessarily about like health outcomes in rural populations, but about kind of like the smaller things that are going on in communities that can promote or hinder health, and well-being. And I think like our kind of like, at least for us, like our traditional ways of working, and like models don't seem to capture like the successes. So like, we are like social isolation is a problem, but actually there's like, 30 different really cool programs going on that no one talks about or they're
Mhm.
not visible. And so we just wanted to kind of think outside our box in terms of how we could capture and share those kind of smaller stories. And it started for us with like that mindset of like assets and strength-based work. Like, how do we pull out those stories of like, there's some really cool things going on in these rural communities, and we think everyone should know about them.
Yeah, absolutely. And something, we've talked about too is this misconception that like the what rural health is like city or metropolitan health just shrunk down a bit, and like
Yeah.
it's so different than that. And it takes so much like knowledge from the community to learn like what health is in that community, and it's different bit by bit. But I think so often it's just like, well, do what you do on a large scale on a smaller scale. And like to your point, like community looks so different and
Very
everything
different.
looks so different, and access and transportation, that it's like we can't just say this is the shrunken version of what the other folks are doing.
Yeah, exactly. And like the resources in the communities are different and like the capacities are different. And so, yeah, you really have to get into those like very local settings to do that work.
For sure. And what made you decide, like when we first started working together, to like seek outside help, being me, as opposed to like handling it internally or doing more of an internal project?
Well, first, your outstanding reputation and work that we've always admired. But so I'm trained in public health. That's my background. And you know, a lot of public health work and healthcare work in general is really focused on data
Yeah.
and outcomes and evaluation and what's evidence-based, which is really important. And I still believe that. And that's sort of like where I come at this. And so when we started thinking about like stories and I don't know, I didn't know where to begin. Like, this is not my skill set. I wasn't taught how to do this. Like, I don't have experience doing this. So I think seeing that there actually is expertise in how to do this, and like, it was really just like a natural fit for us to say, hey, we want to do this. And we
Yeah.
definitely need help to be able to do it.
Yeah. And I think that it's like also, we've talked before about, storytelling as trust building as well. And when we work for these large organizations that have, do so much and have such a reach in the community, I think that there can be something about the like bringing in someone from the outside can be a helpful like bridge of trust building of like, I don't know. I think it can help to like, yeah, I guess in that word itself, like bridge the
Yeah.
large organization with the community that they serve, and sort of
Yeah.
serve as that go between to almost like translate between the two, if you will, and just make it seem like there's this trust building going on of the care in this case is like really invested in making this happen and making this work and putting a lot of intentionality into it. And I think it just shows a lot of that when we like collaborate with other community organizations to do the work we're doing.
Yeah, and I think especially when it comes to, healthcare and health equity, like there is distrust in healthcare systems for a whole variety of reasons I won't get into right now, but I think, you know, like we're fully aware of that. And so going into a community and saying, share your story with us, it's a sense can be sensitive for certain people and certain populations. And so yeah, I think that like third party voice of like, yeah, we're doing this, but we're partnering and can really help with that kind of trust building and openness to kind of coming in and sharing in a way that maybe people otherwise wouldn't.
Yeah, absolutely. And I think that, the last project we worked on together had some different phases to it. So first we built a training around rural storytelling. And like one thing that I really loved about that was our decision, but you really took the charge in how we broadly defined care and caring work. And
Mhm.
it took us a while to like
Yeah.
figure out the right verbiage for that. But I would just love to hear your thoughts on like what care work and how it's different in rural communities and why that really like expansive um definition of like the people who are fixing the cars for the transportation and the community health workers and the people, doing like growing the food for the food pharmacy and just all of these things, like how that all creates this ecosystem of care and caring work and how it's all tied together.
Yeah, absolutely. Yeah, I do remember going over that language and being like, what do we call this group
Right.
of individuals who are out in the community helping people, basically, is what it came down to. But yeah, I think, we're very in our kind of little micro healthcare system, like we have our providers and our nurses and social workers and dietitians and community health workers. And so like we traditionally kind of think of those roles. And then, there's this whole people aren't, that's not it for people.
Right.
People exist in the real world where they're getting information and services from a whole variety of places. And so it might be a community health worker, but it might be, someone at a social service agency. It might be someone who's volunteering, making meals for someone who needs them. So like, I think there's just this whole wide opportunity of like people who might not even consider themselves, what do we call it, care workers, but who like we see in those roles that are so important.
Yeah, and after the training, so we did like three I think it was three different trainings for
Yeah.
community members who are providing that type of care on just what it, why it's important to tell those stories and how, you brought up the importance of data in public health earlier and which is so key and I always say like I love data, like data is
Love
so
data.
important and it
Yeah.
needs to be married to story to be like this healthy ecosystem um and at the same time, we were talking with so many of the folks who came to those trainings about how it matters so much to have like strong storytelling, especially in rural contexts, because numbers look different and data looks different. And it's like this one program might reach 7 people, but the ripple effects might be through like an entire community. Whereas if you like, compared that to a program in a larger health system, like that might seem like, okay, well, we can't, you know, sustain that, but when we can talk about the impact and the lived experience of the people who are touched and held by these processes, like we can just really paint that picture of what that ecosystem is. And the reason I bring that up is that after those trainings we had those days where people could come in and tell their stories and we shared those back with them too, so if they wanted to use them in their own advocacy or communications or things like that. And I was really just struck by the people who did come in and show up, and we had a home
Mhm.
birth midwife. And then we also had somebody who runs a program that knew nothing about where they do no or low cost home improvements to keep people
Mhm.
in their homes. And like that is, and how they have partnerships with healthcare institutions to use that as a like these community members' health depends on them being in their homes and staying in their homes, and like this is public health work. And I was just like, yeah, wow, thank you so much for to that person for seeing themselves in that, and
Yeah.
also like coming to talk about it, like this crucial work of like you know having a home is a cornerstone of our health, and we often like wouldn't group that person into like you're telling the story of rural health.
Yeah, I think that's such a great example of like the people who came. I mean, we had such a diversity, I think, of
We really
people who
did.
came and shared stories, which is one of the things I think was really great about it. Um, and I think we kind of had like a slow trickle of people who reached out, and we started reaching out and saying like, "Hey, I
Yeah.
happen to know that you're doing this amazing work. Like, would you ever be interested in sharing it?" And having those people come out. But yeah, I think like those are the exact kinds of like roles and things that are going on where it's not, it's like our best kept secrets, right? Like we're
Yeah.
like doing all this work that's like making such a huge impact on people's lives.
hmm Yeah, or I other examples are coming to mind too, like stories of like the lengths to which the community health workers will go to like make sure folks are accessing care. And I also knew nothing about the peer recovery coach program and learned so much through that. And
Right.
it's like that is essential health work. Like, it's the reason that people are accessing and maintaining healthcare. And like that's what we're here for. Like that's why we're doing this.
Yeah, yeah, yeah. You're bringing back all these stories for me in my
Yeah,
mind right now.
yeah.
Yeah, I think, and the recovery coach one too. Just I think, um, is such a unique like role, and like she also was someone who I think like didn't necessarily at first like see herself as like having a story to tell. Where like you
hmm
are. I mean, like her background and where she comes from and like her daily work and like she's truly like fighting for the people that she's working with.
Yeah.
And that I think really came through when she was able to kind of open up and share that story.
Yeah, and there was something to me too about it of like that, can't always come through in the data of the like the reason she was in the position to be a peer recovery coach was because of some missteps by the health care system that she then like came back to work for to improve. And it's just like that type of um nuance needs to be captured when we think about folks who are peer recovery coaches and those who are seeking care with substance use disorders and things like that. And it those stories can often get lost, but when we presence them we understand the like breadth and depth of the systems and their impact and like where what needs our attention.
Yeah, and I just to like back up to like your other question, you know, I love data too, but especially in like a rural context, like we do have a small numbers problem,
Yeah,
like where a really important program might be helping a very few number of people. And so like that's going to disappear in statistics. And I think especially like where we came at this, like with a health equity lens, is like that one person's story is really important. And we know that it's not necessarily showing up in data, right?
exactly.
So, yeah.
Yeah, and if it's not showing up in data, we need something to be able to share with decision makers and policy makers who are deciding on these programs to say like, listen to this or read this. Like the impact isn't just in the numbers, it's also in the lived experience of people accessing this. And so that's why I think it's like so key in these settings to be like, and we have the voices of the people most impacted because I say it all the time, but like, you know, for all of its the beauty that it adds to our lives, data is never going to give us like goosebumps or really, really, really stick with us in the way that a story will and like might sway decision making of like keeping something. And it might be having stories and having like storytelling infrastructure might be the difference between like these really crucial programs being, still viable and funded or being, cut off because they don't show up in the numbers as well.
Yeah. And also, as like, just to pull out one thing you said too, like a really crucial way to understand systems, like health systems are complicated things. Like, what is a health system? Like, what does that entail? But, talking to a patient about their experience, like navigating a health need and like scheduling and showing up and like the insurance, like all of those pieces and how they work together. It's hard to fully understand that without those stories of like is how the system is actually functioning from individuals' perspectives.
Right.
Yeah.
Yeah, especially when, health has gotten siloed in so many ways. So and for any of us, like the role we play in an organization, we can't see the full thing. But to your point, if you talk to a patient about what it's like to like get in the system, and like get all the way through it, like we can't see that from where we sit. And even
Yeah.
like folks in leadership positions, they've, you know, are devoted to creating these equitable systems, but we don't know how it is in practice until we talk to the people who are practicing it and
Yeah.
experiencing it. And it can be clunky, but like that's how we improve them. And I think one thing, and like I experience this all the time too, is it can be the smallest things and the smallest tweaks that like are the difference between somebody accessing care or not.
Hmm.
And we only learn that in the story because there's no way to like otherwise record that. And like I said, I feel that with myself too, of like, there are
Yeah.
times where if there's like three extra barriers, I'll give up on making the appointment because like the time I set aside to do that, it wasn't there. And like that's important feedback?
Yeah, absolutely. Yeah. And yeah, you just don't know
Right.
until you ask, right?
Yeah, exactly. And again, and it's not like a system's fault either. Like, yeah, like they couldn't know. How would you know that
Yeah,
that's like why
yeah.
people aren't coming? Yeah, which is why we have to listen to the community. Um, and I wonder if, like, we've talked about some of those really beautiful stories that came out in that work. And then maybe you know this, but we haven't talked about it. But then I worked with another part of your team a couple months later or like a year later to do almost like a pop-up storytelling booth at a symposium, which was fun.
Yeah,
And
that's
it was
right.
sort of like a Hail Mary, like it was a couple days before, and they're like, "Can we do this?" And I was like, "We absolutely can do this." And it was a fun, just like exercise of having stories told between, people coming and telling their own stories or conversations. And the symposium was about like rural health, but also bringing together research and practice. And it's like, again, so much can get lost in that. And so often these systems aren't talking to each other when it's like how research is implemented. But when we can bring people together and like have those conversations, especially if we can make it like a cute little moment in a booth, it just like, it really makes a difference to be like, we all have to create this system together and create it and then hold it together. And like, we can't hold it together if we don't know what's going on inside of it.
Yeah, and I have to say very humbly that I take a small amount of credit for an increased interest like in storytelling among our partners and those around us after the work that we did with you and like the
Right.
stories we recorded and shared and disseminated that people were like, oh, this is super cool. We want to do this too. And I think
Yeah.
that was one of the great like externalities of what we did, is that people, I think one of the best ways to know if people saw value in it is people trying to do more of it, right?
Yeah,
So,
exactly. Yeah.
yeah. So I think that really showed up. And, at that symposium, we put like some blurbs about the stories that we recorded, or that you recorded with us with like, a QR code so people could like click on one and listen to it. And it was like, and you can record your own too. Like, did you
Yeah.
like what you heard? Like, you probably have a story to tell. So I think like just even just listening to them can be inspiring if don't, again, you're trying to reach people who don't necessarily see themselves, in that role.
Yeah. And I think the best way to have people see themselves as storytellers, which like it is my firm belief that we all are, because like we all, call our friends and tell stories and sit at dinner
Yeah.
tables and like it's literally in our DNA. But, like so often it's like if you just play them a story of an everyday storyteller, then they're like, well, then you should know this. And it can be such a fun, it's like we get a little competitive about it. And that's the best, because it like
Yeah.
prompts more storytelling of like, well, if you know that about that part of the system, you should know my part. And it's not even competition, but just this like, we should be seen then too if we're
Yeah.
seeing, all these others. And it's like, yeah, absolutely, you should. Like, come on over.
Yeah. Yeah. Come to
Or
our
you're,
table. We've got
yeah,
room.
exactly. Yeah. I think you should not humbly say that. I think you should say that very loudly. Like, it's a big, and it's like, I think that's one of the my favorite things about this work that I just like love so much is that the ripple effects of it, like you don't always know, and it's like what that might have prompted from that person and things like that, and then it's just like you lose, you can only hold the part of the process you hold, but then like seeing how it ripples out is just the best.
Yeah, absolutely. Totally
Yeah,
agree with that.
yeah, it's so festive.
Yes.
And I guess like with that, you sort of led into this, but have you seen any like changes within care or as you mentioned, like outside of, since we work together of like, connections with the community or just like, the way your work is landing now that there's like storytelling sort of woven in with it?
Yeah, I mean, I definitely think, and we continue to share these stories in a variety of like platforms and channels in different ways and at events and um, we'll have a list up with like QR codes so people can listen in at like a tabling event we're going to tomorrow. So like we're continuing
Yeah.
to do that, I think. And, I think one of the things like I remember you saying when I asked you about like how do we disseminate this? Like what strategy should we use here? And you were like, these don't have an expiration date.
Yeah.
Oh, you're right. Like, it's not like, oh, the data's outdated. It's like, no, this is still a really awesome story. It is today, it will be tomorrow. And so we're still continuing to share those. And I think we've also, like, as a result of that, like, I guess 2 points I'll make is that, I do think we're reaching different people than we would otherwise. Like, I think it's just people connect with stories. So someone who, you know, might um, we might have like new subscribers to our newsletter or like new people interested in joining our teams as a result of just being able to share these and people kind of connecting with that work. Um, and, I think also people coming to us and saying, this is really cool, we're interested in doing more of this.
Hmm.
So one of the things we hope to continue doing is like skill building and storytelling, like
Hmm.
how to tell your story. Like the workshop series that we did initially together. Because I think we see a lot of interest in that. Like people are like, oh, we like this, we want to do it. We're not totally sure how to go
Hmm.
about it.
Hmm.
And then, you know, this comes up all the time for us too, but storytelling for policy and advocacy,
Yeah.
like if, encouraging people just to be more civically engaged. And oftentimes that looks like telling your story.
Yeah.
Policymakers are no different than anyone else in that they're more likely to connect with a story than a data
Hmm.
point. And you hear this
Hmm.
all the time. And so we're really interested in helping people think about like storytelling skills and then like how could that make a difference and like if you care about any policy issues or it could be advocacy with a little a just like advocating for an issue or a topic that you're passionate about like getting out there with stories is super important. So
Hmm.
we've definitely seen, I think, like at least for us, people are like, oh, you've done this, like we want to talk about it with you. So more people have reached out to us and yeah, and definitely hope to continue doing more of that too.
Yeah. I love that. And I think that there's I think we under unless we've worked or know somebody who's worked in a like policymaker, especially like lawmaker um office, we underestimate like how many reports hit their desk every day and how like that work is of course so important, but it is, as to your point, that like the stories that often like stick with them or sway their decisions or um yeah, and or just like humanize, the things that our reports
Yeah.
can't quite, and and there's ways too with reports to like add them in, so it's like we have both, and again, it's like that marrying of data and story and treating story as data that really gets us there.
Yeah, yeah, absolutely. And I think, people I hope at this point in time are like more apt to be like civically engaged. Like I think people are looking for ways to do that. And so I think this is like a really great time to be kind of helping people gain those skills and like figure out how to hone a message and get it in front of the right people.
Yeah, absolutely. And I don't know about you, but I get the question a lot too of well, to back to what you're saying too about, people saying like, how do we do this? And we were talking about like trainings, and I think so often it's like the training process is actually just more of a demystifying process. And
Yeah.
again, like we said, it's like you know how to do this. Like you know how to talk to people, like what's compelling, and it's just like that extra support to be like, this is a very human process that there are so many ways to like operationalize and like make, a part of your organizational DNA, but it really is so much like you have the skills. Now we just demystify like all of the like what's been added on as, making it seem like a sort of unattainable or hard to do thing.
Yeah, it's like it's this thing I've done like in my personal life, like how do I do it professionally and like how do I use it strategically, I guess, is like that
Absolutely.
question. And that's where we were at when we reached out to you, being
Yeah.
like, this is like, what do we, how do we, what do we do?
Yeah, 100%. And yeah, and that's like my favorite thing to do. And I think there's also to your point about advocacy and getting folks engaged there is um we are in a moment and we have been for a long time, so I guess we can't even call it a moment, a season maybe
Mhm.
such an influx of information, and a lot of people that I talk to and work with will say, like, well, how do we go up against the like fake stories or the co-opted stories and things like that. And the example I always give is that like our job is not, and this is like some like niche nerdy narrative strategy stuff, but is not to like, we don't want to say what we don't want the narrative to be. Like we don't want to repeat back what we think are like the false narratives and things like that. But what we
Yeah.
can do is just like flood the ecosystems and the channels and everything with like true, authentic human stories told in the voices of the people who are experiencing it. And then we don't have to worry so much about like what's true and what's not, because it's just like we have an abundance of these stories that like build on each other to create this narrative of like what life is really like for individuals, for communities, for collectives and things like that. And so it takes some of that, like, I think fear about like, how do we go up against? And instead is like, well, how do we do this well in a way that we then don't have to like be so concerned with like more of a like, um, butting heads, and instead more of a just like, we're telling the stories that are true to us and that
Yeah.
like fuel our communities. And like, that's our only job right now.
Yeah. And I think like in a vacuum, those false narratives and misleading stories like will fill it, right?
Yeah.
So, and like we have seen this in public health, like, I
So starkly.
like very starkly. And, I think public health as a field has not done a great job historically of like getting out and telling stories about, it's almost like it's very quiet. Like when you do a really good job with vaccination, no one gets sick. And then
Hmm.
like, and then all of a sudden people are like, what's the point of vaccinations? No one gets
Uh-huh.
sick. And it's like, well, that's because we didn't tell this story. And there's a really important story there. And I think that's the case with a lot of public health issues. And so, yeah, just like we just got to flood the airwaves. Like, here's all the important, like kind of true stories and
Hmm.
people's experiences, trying to achieve health and well-being.
Yeah, 1,000%. And like, I often also say, like that public health, it can be, we're so like boring in our communications because we're so like precious about it. And like, being
Yeah,
like, well, we have to get it exactly this right and it has to meet like this comms goal and it has to, include this and we can't quite. And it's like, no, we actually just need to say things in a way that people can like hear them and resonate with them, because the way public health right now talks to people is often so like, it's not how anybody talks or like absorbs information. And it's like you have to have an MPH or even like a DRPH to be able to like decode what this really simple message should be. And so it's like that's where a
yeah,
story can be so helpful to like capture all of that nuance and tell that really complex story without having to like get so sidetracked with the like this minute detail and saying this exactly right and da, da, da. It's like, no, we just need to actually meet people in a
yeah,
way where they
yeah.
communicate and not be like, no, you have to adjust to our communication style. Like our
Like we're
job
gonna,
serving
yeah.
communities, yeah, is to talk to them how they talk.
Yeah, and to like engage with you on it and to like
Yeah.
genuinely answer questions and
Yes.
like, reflect on like what concerns are. And I think like that's all part of that process.
1,000%. Yeah. Yeah. And you brought up vaccines and I think about it a lot right now with insurance and like access to insurance and like how
Yeah.
are those stories, like how do we tell the stories of of the complexity of that web of like getting, coverage for care. And it's not going to be by like speaking insurance language with people. Like that clearly is not working.
Yeah, absolutely. Yeah, that is definitely not working.
No.
And even I think with the insurance coverage and people's again, it's like how are you navigating that process of like signing up for insurance at this point in time? Like, were you able to find a plan? Like,
Hmm.
what does this mean for your household budget?
Hmm.
Because your health insurance has, doubled, tripled, quadrupled.
Yeah.
And like what are you not able to spend money on because of your health insurance
Hmm.
is like a
Hmm.
huge part of like the experience and the reason that this is problematic that we need to be paying attention to.
Yeah, 1,000%. Because that's money that like then doesn't go back into the community and doesn't go, just yeah, it's so many things there. That's a whole nother 7 hour
Yeah, oh
conversation. But
yeah.
um,
Our
so I guess
next conversation, yeah.
yeah, exactly. So one question I would love to sort of end on is, what would you say to other organizational leaders and people in roles like yours who are on the fence about taking on storytelling or taking it seriously or opening the door to storytelling?
Yeah, I mean, I think like we talked about a little bit, but like not everyone is a numbers person. Like
Yeah.
you're going to be more successful by incorporating stories into like your evaluation, program development and strategy. I think when we started working together, like we sat down and like you wrote out like a map. There was like a process. It was like we're going to
Mhm.
meet this time. Here's what we're going to go over. Like here's the steps we're going to take. Here's like, and I think like it was not challenging. It was super like straightforward for us, like even as people getting into it who didn't know what we were doing at first. And so, I think it's going to be it's going to be super helpful, and there is an actual process you will follow, and it will be helpful.
Yeah, we're not walking through the wilderness here.
Yeah. Yeah, if we're not just like randomly out like on the streets
Hmm.
talking to people, like we're doing this in a way that reflects our goals. And I think like again, like it, we working with you, you were super thoughtful about like, yeah, who are we trying to reach? Like, what is the language we should use to reach them? And like, where do we even like put this information out to get in front of people? And I think just being able to like sit down and think about how this is aligned with your goals and strategy and all of that. Like, yeah,
Yeah. I think I appreciate you saying that so much because I think that there's often this misconception of like if like storytelling is I use this word earlier almost like the wilderness and like we can't meet our comms and advocacy and strategy goals if we like let go of our, talking points and messaging and things like that and let storytelling come in. But like I promise everybody that the stories you will get will further support you in meeting all of those goals than like the current messaging that is in place because it again it's that like action that's like that true community experience that shows us our blind spots and brings out the truth and connects with decision makers and policy makers and things. And so it's like I think so often there's that apprehension about like letting go of control a little bit, but I always say like the looser that we hold storytelling and again with processes with with goals in mind and things like that, the more likely we are to meet actual goals than if we just like try to like confine it to talking points and like train people on how
yeah,
to tell the story and this that and the other thing. It's like yes, people need frameworks and support and things like that, and like we've got all that, we can do that, but like then there's this point where you just have to like let the unknown happen, and in that unknown is the real magic that like meets our goals, forwards our strategy, like all of these things. It's just like that little bit of letting go of control makes it all possible.
yeah, I think so too. And just kind of seeing like where it goes and, who can connect with it. And, I'll add one other thing to that question too, which is that I think there's a super important role for storytelling and like some of the things we talked about, like people's, experiences with healthcare and health systems, which are often really, personal and
Mhm.
challenges that we want to hear, like we want people to share. But I think where our starting point was too is that like this is a good tool to use to talk about like assets and strengths and
Yeah.
like solutions to problems as well. So that, I think there's probably more stories we hear of kind of that like challenges and barriers part, but I do think like there's many different, not those being two, but like many different other ways too that stories can be used to kind of advance work and goals and think about like what is the story we want to tell and who do we want to hear it from.
Yeah, 1,000%. Thank you for saying that because it is also like what comes out, I think, often when organizations are like weary of what, what might be said and things like that. And then they hear the stories and it's like you live in a community of folks who've had, varied experiences with your organization, but also like depend on it and like had their babies there and like
Yeah,
all of these things. And like those are beautiful stories. And like if our goal is for thriving communities, like let's listen to the ways in which those communities are thriving and like
yeah,
continue to build on that.
yeah, absolutely.
Yeah.
Yeah,
It's not like a tear down
it's not a
situation.
tear
It's,
down. No,
yeah, no,
it's
not at
not
all.
scary. No.
No. Oh, Chelsey, thank you so much. It was so fun to chat. So often when
You
we have
too.
time to meet together, we're talking not so much about this stuff, but about like
I know.
scheduling and things like that. And it was so fun to just sit and talk about,
Yeah,
all the
it's so
ways
nice
that,
to catch up with you. And yeah,
yeah,
we should do it again.
definitely. All right. Thank you so much.
Thank you.
Bye.
Bye.